Dr. Pat Bruno talks about the effects of drug use during pregnancy and on the infants after they're born.
I was in private practice for 25 years down in Sunbury, seeing kids, and you could probably count on one hand in the course of a year the number of moms that we had that had problems with drugs. Things have changed, I mean, just drastically. And it's unusual not to have somebody in the nursery up at Geisinger that the mom has had drug problems. First trimester pregnancy percentages are around 5 to 10% now of women are involved in major drug types of things. Probably around 15% binge alcohol problems during the first trimester, and cigarettes is 15 to 20%. The neonatal abstinence syndrome was primarily devised, that nomenclature was devised for kids that are withdrawing from heroin. So they're exposed to the heroin in utero for long periods of time, and then they come out and they go into withdrawal. And we see that quite frequently in kids at Geisinger. Now, there are other drugs that can cause that sort of problem as well, withdrawal. But I think it's been more the opiates. And part of that is because there's more of a culture of utilizing opiates, not necessarily heroin, but fentanyl, other types of opiates that you can get prescribed for you for pain. So,
what happens to a baby who's going through withdrawal?
It's a horrible thing to witness. They're really, really, really hyper, excessive irritability. They can have vomiting. They can have diarrhea. They can not want to feed. They can lose tremendous amount of weight. You just tap the isolette and they go crazy. They can have seizures. It just goes on and on. It's just a horrible thing to see. And sometimes they have to be medicated. They actually have to be given a morphine type of drug to help them get through that period of time. And it can last for months. God only knows what the long-term effects are.
That was my next question.
Yeah, nobody knows. The studies aren't there. The studies just aren't there about long-term effects. And they're not there because there are confounding problems. Dysfunctional families, dysfunctional environment, and it's hard to hard to eliminate some of those factors that would play a role in the kid's development.